initially, this is secondhand, I wasn't there during the early parts, but initially there was a study done of trans health in this area. And this area is actually a fairly large, like, okay, Northampton itself, but that's only a very small part. There's upstate New York, there's Western Connecticut, there's Western Massachusetts, all these rural areas. So a study was done looking at the needs, and there was definitely a need. A lot of people driving 2 hours to go see a doctor, and waiting 6 months to get into places. And obviously that doesn't work for a huge number of people. And a big part of that work was done by someone who's one of our social workers. Brooke is amazing, and she just learned the community and met people and talked to them and collected stories at focus groups and one-on-ones. And she's just, I mean, it's incredible. And we found there were 3 big needs. One was primary care, one was hormonal care. One was primary care, including hormonal care. One was mental health care. And the third was reproductive health. And so we realized, the team realized there was a need, and decided from the very beginning it was going to be a model centered on transgender people. We, as our clientele, we take people who are transgender, gender diverse, non-binary, gender questioning, and their families and their communities, and realize that that's really who's centered here. I honestly, as a cisgender provider here, I am so fortunate, because I am hearing stories and seeing things from a front line that would not be part of my experience normally. And the fact that my colleagues trust me to talk to me about these is just so amazing. And so we have the majority of our employees come from the community. The chairman of our board is now a trans man. Our CEO is now a trans woman. I mean, it really is something that is from the community and of the community. I've already told them I've picked who our second pediatrician will be when she finishes residency in 3 years, because I can tell you, I had a patient I saw yesterday who had heard all sorts of mythology about how bad top surgery is, how much it hurts, how long the recovery period is afterwards. I'm able to pull in someone who's had top surgery to talk about it. And another person come see me who has never met a trans woman, and she is trans, and I can't imagine how lonely and scary that must feel. But because of who we are, she will meet trans women here. She will get to see the statistics that we see that are horrible don't have to be where people end up. That she can fight against anything she needs to and be strong and, end up being a CEO of her own company somewhere. And I think that is really important. It's also taught me a lot about, and I would say this for all cis providers involved with trans care, and there are a lot of us, is learning when you stop talking and you sit back and you listen to what people are saying. As a doctor, that sometimes is hard. As a man, sometimes that's hard. As a white man, that sometimes is hard. And relearning that has been very, very important. And I've learned a lot there. And having people who can tell their own stories is really what's important. And I think that's really what one of the things that trans health brings is we have people telling their own stories, creating their own systems. And that may mean I need to adjust sometimes. And I have had to adjust sometimes. And that's a good thing. I should have to do that in my life.